Hello, welcome to Stanford and welcome to the Stanford Kidney and Pancreas Transplant Program. My name is John Scandling. I am a transplant nephrologist and medical director of the program. We are happy that you have chosen to be evaluated at Stanford for your transplant. We look forward to meeting you. Transplantation is a complex process. We have made this educational program to help prepare you for your visit with us. This program will help you and your family members learn about transplantation and the treatment options available to you. We will discuss normal kidney function, end-stage kidney disease, treatment options for end-stage kidney disease, an overview of transplantation, transplant surgery, life changes after transplantation, and the commitment required from you for successful transplantation. A kidney transplant can greatly improve your quality of life and life expectancy, but it is more than just an operation. It is a lifelong commitment to daily medications and to a working relationship with your transplant team, your local kidney doctor, and your primary doctor. Our goal is to teach you about the way from evaluation to transplantation to life with a transplant. We encourage you to ask questions. Learn all you can about transplantation. For many patients, life with a transplant is superior to life with dialysis. If you are interested in transplantation, we encourage you to talk to your kidney doctor and family. Pursue transplantation only if you consider it best for you. Do not pursue transplantation simply to please your doctor or your family. Please do not put off dialysis in the hope of receiving a kidney transplant. Follow your kidney doctor's advice about when to start dialysis. Postponing dialysis may jeopardize your health and readiness for a transplant. We evaluate each person as an individual. We will be honest with you throughout the process. We need your full participation every step of the way.
The chief purpose of kidneys is to remove waste products and excess water from the body. The kidneys have an amazing capacity to perform their work even when they are diseased. The kidneys also help regulate body salt, acid and fluid content, produce hormones which regulate blood pressure, produce erythropoietin, which stimulates the production of red blood cells, break down insulin. Diseased kidneys will eventually fail in performing their job. This is called end-stage kidney disease. Once a patient has end-stage kidney disease, there are only two treatment options available: dialysis and transplantation. You and your kidney doctor will decide the type of dialysis best for you based on your medical history and lifestyle. For many patients, kidney transplantation is preferred over dialysis. It can provide better quality of life and greater life expectancy than dialysis. However, transplantation may not be an option for everyone. These are some of the conditions which may prevent transplantation: active infection, active cancer, advanced heart disease, severe peripheral vascular disease, failure of organs other than the kidneys, psychosocial issues such as substance abuse, morbid obesity. If you qualify for transplantation, you may receive a transplant from a living donor or from a deceased donor. A kidney transplant from a living donor will provide you the best outcome. Kidneys from living donors work right away and last longer than kidneys from deceased donors. A deceased donor is someone who has died and offered their kidneys and oftentimes other organs for donation so that others might have the chance for a better life. In the San Francisco Bay Area, the waiting time for a deceased donor is very long, ranging from 3 to 10 years at current time in 2015. The waiting time can vary depending on your blood type and your level of sensitization due to antibodies you have formed in your lifetime in response to blood transfusion, pregnancy, and previous transplantation. During your transplant evaluation appointment, you will meet members of the transplant team, each specializing in different aspects of transplantation. You will meet a transplant nephrologist, transplant nurse coordinator, and transplant social worker. You may also be seen by other members of the transplant team, such as the dietitian and transplant pharmacist. We will obtain a complete medical history from you and perform a physical exam. We may ask you to do some routine medical testing, such as blood tests. You should bring a copy of your medication list and medical records from your kidney doctor, primary care doctor, and any other providers involved in your care, such as your cardiologist, vascular surgeon, and gynecologist. Following the evaluation appointment, our transplant team meets to discuss each of the candidates who underwent evaluation the week before. Each patient is presented to the team for consideration of candidacy for transplantation. The three possible decisions made by the transplant team are accept, decline, or defer. Your transplant nurse coordinator will notify you of the decision. If you are accepted, your name will be placed on the waiting list for deceased donor kidney transplantation once the blood tests required for listing are completed. The national waiting list is managed by the United Network for Organ Sharing, UNOS. While on the transplant waiting list, your status is either active or inactive. Regardless of your status, you are accruing waiting time. You will be notified of the team's recommendation by telephone and by mail. Your referring nephrologist and dialysis unit staff will also be informed. Listing you for transplantation does not mean that you are ready to be transplanted immediately. You may require further medical studies closer to the time of transplantation to complete your preparation for transplantation. Only patients listed in active status are eligible to receive organ offers. After your transplant candidacy has been approved, anyone who would like to donate a kidney to you can contact our transplant office or donor web link for medical screening. A living donor kidney transplant can provide the best outcome for you. The number of patients on the national waiting list is now over 100,000. The number of deceased donor kidney transplants performed each year in the United States is around 10,000. There are additional 6,000 to 7,000 living donor kidney transplants each year. We encourage all candidates to consider living donor kidney transplantation, which could mean transplantation within months rather than years. A potential living kidney donor can be an immediate blood relative, such as a sibling, parent, child, or a person with an established relationship with you, such as a spouse, friend, or distant relative, and must be freely willing to donate without coercion or financial gain. In good physical and mental health, 18 years of age or older. Living donors undergo various testing, including compatibility testing, blood typing, tissue typing. Once compatibility testing has been done, the donor must undergo a very thorough medical evaluation, including additional blood tests, urine tests, chest X-ray, EKG, and imaging studies of the kidneys. If testing shows that your donor is not a compatible match for you, Stanford has alternative programs that may still make living donor transplantation possible. Please understand that the expense of evaluation of a potential living donor is the responsibility of the recipient's medical insurance. Consequently, charges for a donor evaluation may appear on the recipient's insurance bill. It is also important to understand The results of a potential living donor's evaluation are confidential and cannot be shared with the recipient. Two options available for living donors are paired and chain donation. In the past, an incompatible living donor was unable to donate a kidney, but now we offer multiple potential ways to overcome this incompatibility. Paired kidney donor program or donor chain programs are amongst the options. With paired organ donation, your donor exchanges his or her kidney with the living donor from another incompatible donor recipient pair to create two compatible pairs. While it is true that your donor will not directly donate his or her kidney to you, exchanging with another incompatible pair will allow for two compatible transplants. Donor chains work similarly to paired kidney donations in that they take advantage of healthy and willing but incompatible donors. With this program, incompatible pairs are matched up with other incompatible pairs around the country so that compatible transplants can be performed. Through this program, we have successfully transplanted many patients who would have otherwise had to wait many years for a deceased donor transplant. Desensitization and ABO incompatible transplantation are two other options available for recipients with living donors. Approximately 30% of patients awaiting a kidney transplant are considered sensitized or have antibodies against a potential kidney transplant. These antibodies are acquired most commonly from previous transplants, blood transfusions, or pregnancies. Having antibodies against foreign tissues makes it more difficult for patients to find a compatible living or deceased donor kidney. Desensitization is a process that removes or lowers the levels of antibodies against a potential kidney transplant. Stanford is one of only a handful of programs nationwide that offers desensitization to patients awaiting deceased donor or living donor kidney transplantation. There is a 35% probability that two people have incompatible blood types. As many as 1/3 of potential living donors are excluded due to incompatible blood types. The Stanford Kidney Transplant Program offers patients the possibility of transplantation despite incompatible blood types. As mentioned previously, the waiting list for deceased donor kidney transplantation in the United States is managed by the United Network for Organ Sharing, UNOS. In December 2014, a new system for distribution of kidneys began. The new system is expected to help more people have longer function with their transplant kidneys and shorten the waiting time for some groups of kidney patients who often wait a very long time because they are hard to match with most kidneys. A major change in the new system is that waiting time will now include time spent on dialysis prior to being registered on the wait list. This means that the listing date will be the date chronic dialysis started, not the date that the transplant team accepted the patient as a transplant candidate. As under the current system, candidates who have not started dialysis will be eligible for listing once their glomerular filtration rate or creatinine clearance is less than or equal to 20 milliliters per minute. The new system will consider two new scores, the KDPI and the EPTS, when distributing kidneys. What is a KDPI score? Every kidney offered for transplant will have a Kidney Donor Profile Index score. The KDPI score ranges from 0 to 100%. The KDPI score is based on a number of donor characteristics and health factors. The figure below shows the life expectancy of a kidney with consideration of its KDPI score. What is an EPTS score? The EPTS score is an estimate of how long a kidney transplant candidate will need a transplant kidney in comparison to other candidates. The score is based on age, length of time on dialysis, history of previous transplant, and presence of diabetes. Under the new system, all kidneys are distributed in the following sequence: highly sensitized patients, 0 mismatch, top 20% EPTS for kidneys with KDPI score of 0 to 20%, prior living donor, children, waiting time. Currently, the waiting time in the San Francisco Bay Area is long. It can range from 3 to 10 years, depending on your blood type and level of sensitization, or level of antibodies. Blood groups O and B have the longest wait. Some candidates with blood type B may safely accept a kidney from an A2 or A2B blood type donor. You will be told if the transplant team thinks this is a possibility for you. There might be a time when you are offered a kidney from a higher risk donor. Higher risk donors are individuals at higher risk for developing certain infections that can be passed on to a transplant recipient through the transplant organ. While the detailed reason for the donor to be considered higher risk cannot be shared with you, your transplant surgeon will discuss the situation with you and advise you. You may decline a kidney from such a donor without penalty or effect on your waiting time. While we try to stay in touch with you during your waiting time, we also expect you to stay in touch with us and contact us if there are any changes in your address, phone number, or living situation. You change your dialysis unit or type of dialysis. You change your job. You change your medical insurance. You may want to contact our financial coordinators if the choice of medical insurance offered by your work changes. You have a new diagnostic test such as a heart or brain study. Your health changes. You require hospitalization or surgery. You receive blood transfusion. Kidney transplant surgery usually takes 2.5 to 3 hours. When you are brought to the operating room, the anesthesiologist will give you a sedative to help you relax and will prepare you for surgery. You will be connected to various machines to monitor you throughout the operation. Your native kidneys are usually not touched during transplantation. An incision is made in the lower part of your abdomen on either the right or left side. The transplant kidney is connected to blood vessels in your pelvis, and the ureter is connected to your bladder. A catheter is inserted into your bladder during the surgery. This will be removed 3 days after your operation. Following surgery, you will be transferred to a nursing unit, and you will soon be encouraged to get out of bed. You will be given fluids through an IV and pain medication to keep you comfortable. Your stay in the hospital will be 3 to 5 days. During this time, you will be under the care of the multidisciplinary team. Dialysis may be needed if the kidney does not work right away. You will have a one-on-one teaching session with the inpatient coordinator prior to being discharged from the hospital. During this teaching session, You will learn about the signs and symptoms of rejection and infection, your medication regimen, the immunosuppressive medications and their common side effects, how to take care of yourself after transplantation, how to adjust to your new lifestyle following transplantation, how to contact our team in case of emergency and after-hours needs. Rejection occurs when your body recognizes that the transplanted kidney is not the same as your own body tissues. There are two types of rejection: acute rejection. Early detection and prompt treatment can reverse acute rejection in most cases. Chronic rejection. This can occur as time passes after transplant. If you stop taking your immunosuppressive medications, rejection will happen. Immunosuppressive medications are given to prevent and treat rejection. While they help protect the transplant kidney, they impair your immune system and can have side effects. These medications must be taken on a regular basis for the life of your transplant kidney. The following is a list of most common side effects of the immunosuppressive medications, but many patients have little trouble with them. Increased risk of infection, increased blood sugar, increased blood pressure, increased cholesterol levels, increased risk of developing cancer over time, kidney toxicity, stomach upset, bone marrow suppression, neurological abnormalities, delayed wound healing, mood swings. We will follow you very closely during the first 4 months after transplantation. We will provide you with a schedule prior to your discharge from the hospital in regards to the frequency of your visits. You will have blood tests along with each clinic visit and more frequently if needed, as directed by the team. During routine labs, we will monitor you for rejection, infection, or any other potential complications. A few months following your transplant surgery, you will return to the care of your kidney doctor. You will be asked to return to see us regularly for the first year and annually thereafter. You will be expected to have surveillance transplant blood tests on a regular schedule, which will be given to you. We will review the test results and make adjustments in your immunosuppressive drug doses as necessary for the life of your transplant kidney. Along with the hopeful anticipation of a transplant, it is normal to experience feelings of uncertainty during the waiting period. You and your family may feel out of control. This can be an emotional time. You may experience fatigue, depression, mood changes, and frustration. Your family may feel worried. There may be a lot of questions on your mind. When will a kidney become available? When will I be transplanted? Will the transplant be successful? How will I manage financially? When will my life get back to normal? How will my family cope? Despite these uncertainties, there are coping skills that you and your family can learn to adjust to living with a chronic illness. You can explore the coping skill that meets your specific needs with your social worker at the dialysis unit. When you meet our social workers during your evaluation appointment, they will be speaking to you about their role, the emotional impact of transplantation in your life, importance of your support system, caregiver, in the success of your transplant, transition and life adjustments after transplantation, and importance of adherence to your medical regimen. Your adherence to the treatment prescribed by your local medical team is an indication of your ability to follow instructions following transplantation. Transplant social workers will perform psychosocial evaluation and make recommendations to the team and to you about required psychosocial support. They can provide you education and guidance on how to seek out community resources if you need support beyond what is being provided to you by your dialysis unit social worker. The social workers will speak to you about the possible need for temporary relocation post-transplant to ensure that you have access to follow-up care, emotional impact and stressors of transplantation, family dynamic changes following transplantation, role reversals during the first few weeks following transplantation, shift in life patterns, need for caregivers immediately following transplantation, fatigue during your recovery period, medication side effects and their potential impact on your life, financial considerations, and return to wellness. Transplantation is never done alone. Your support person, caregiver, needs to provide you support with transportation, especially during the first few weeks following your transplant, assistance with medications, assistance at home and with daily care, emotional backing. While you wait for a kidney to become available for you, it is wise to consider saving money for associated costs such as housing, gas, medication co-pays, and share of cost. Remember that if you run into any insurance issues during the transplant process, our financial coordinators are your best source of information. They can also help you apply for any patient assistance programs. While you wait for your kidney transplant, we want you to stay in touch with us. Please respond to any communication that you receive from us. Stay active, lead a healthy life, and take care of yourself. Educate yourself. Do not put your life on hold until transplant. Other members of the transplant team who are involved in your care prior to your transplant and will follow you closely after you receive your transplant are the transplant pharmacist, whose goal is to ensure that you realize the importance of your immunosuppressive medication in protecting your kidney against rejection, know about your medication regimen, are familiar with the possible side effects of the medications you will be taking after your transplant, understand the importance of proper dose and timing of taking your medication. After kidney transplant, you will need to take an average of 10 to 15 medications daily. These medications will be taken 4 to 5 different times a day. A medication list will be provided to you after you receive your transplant. The transplant dietitian will teach you about proper nutrition, which has a direct impact on the rate of your recovery. Your new transplanted kidney will allow you much more variety in your diet. Your dietitian will help you make food choices to regain strength following surgery, heal quickly, and help your whole body to function as well as your new kidney. Before going home, you will receive nutrition education to continue a healthy style of eating. Your transplant dietitian consults with your doctors as well as other members of the transplant team to provide you with the medical nutrition therapy that meets your needs for healing, weight and blood sugar management, food safety, and general good health. Our financial coordinators will provide you with information to help you make educated choices about your insurance options and your out-of-pocket expenses. It is very important that you know your insurance plan. Please tell us of changes in your health insurance. If your job changes, there is a possibility that your insurance may change. It would be beneficial for you to contact our financial coordinator for guidance with regard to your insurance options with a job change. If your eligibility for Medicare is based on having kidney failure, please keep in mind that Medicare coverage is available to you for only a limited period of time following transplantation. In order to provide greater access to our patients, the Stanford Kidney Transplant Program has established outreach clinics in various locations around the San Francisco Bay Area. If one of our outreach clinics is closer to your home, you will be offered this option when your appointment is scheduled. If your transplant evaluation is at one of our outreach clinics, our transplant team will be meeting with you at the designated clinic and will assist you in arranging the required studies for your evaluation. Prior to your appointment, we will call you to obtain a complete medical history from you, and a physical exam will be performed at the time of the evaluation. You should bring a copy of your medication list and medical records from your local nephrologist, primary care doctor, and any other providers involved in your care, such as your cardiologist.
If you have type 1 diabetes and you are a candidate for kidney transplantation, you may also be a candidate for pancreas transplantation. A pancreas transplant will provide insulin to control your blood sugars. The success rate of combined kidney and pancreas transplant, or SPK, is close to the success rate of kidney alone transplantation. However, combined kidney and pancreas transplantation requires a longer surgery, a longer recovery, and the risk of complication is greater. For further information about kidney and pancreas transplantation, please ask us. I am Stefan Busk. I'm the Surgical Director of the Kidney and Pancreas Transplant Program here at Stanford. We hope that you can receive a kidney transplant, and we will support you throughout the process. You will need to remain committed and motivated for the transplant to be a success. Thank you very much for your attention.